So I'm taking off the old mixing tip, the one that contains the material that's already set, and I want to put on a new mixing tip. But before I put on the new mixing tip, let's bleed the cartridge. What we've developed in our office is when we do our bonding system, we start off with the microprime desensitizer first, then we move on to the primer, and we move on to the adhesive, which is the bond. We've got matching brushes. These are all the same kind of brushes. The tips are all the same, but we decided to match the green with the green, the purple for the primer, and the blue for the bond. The reason we want to do that is if we're doing multiple fillings, we can reuse the same brush and not be confused about cross-contaminating. For example, putting this on that brush or putting this on this other brush over here. It keeps it all the same, so there's no confusion and there's no mix-up in the chemistry.
Trays. You will notice on the trays, I'm going to use this blue one, it's easier to see. This one would be used for a larger teenager or a young adult. There is a U that's for the upper arch. So you'll fold this over when you put this tray in. I usually shake it to get it to be a little bit thicker, and you're going to squirt it into the tray like this. You'll notice that it grows, so you're not going to want to fill it up to the top.
When loading a syringe, a few things to keep in mind. First of all, the actual syringe has within it this harpoon-looking tip. That tip is going to be plunged into the back end of this anesthetic cartridge. We want to make sure that the guide that we use is lined up with the actual sensor. And so you'll see right here, if the X-ray tube is going to be lined up and shooting straight down here, we want this sensor to be lined up right in the middle of this, kind of like a bullseye. If I were to take this ring off and put it on another way, if I were to put it on like this, you can see that it is not going to go, as it goes straight through here, it's not going to hit the sensor. And so it's going to be off-centered, and you're going to get what's called a cone cut.
Materials, it'll stretch, so if you have like a little bit larger model and you're trying to get it, you can kind of push it and, you know, manipulate it where you want it to be. Because it's sticky, I always put a little bit on the outside also, just to, this helps me to be able to move it around easily, nicely. And if you fold it towards the front, you can get yourself a little hand.
It has the sensor, and then it's got this piece in the middle. This is where the patients are going to bite. So the way this works is we're going to take and have them open, move it as close to the midline as you can, close to the tongue, so that when they bite down, they're not going to bite the floor of their mouth. Have them bite in this direction.
Okay. Relax your cheeks again. And bring your teeth together.
Take a look at this panoramic X-ray. Tooth number 1 has decayed down to the roots. Only the root tips of number 18 remain. There is deep decay on number 2 and 32. Notice the gum line is red. That is a sign of gingivitis. The white spots on these teeth is caused from poor oral hygiene during orthodontic treatment or from drinking cola drinks continuously during the day. These teeth will have to be treated with fillings that wrap around the teeth. Distal and lingual walls are all reduced and the occlusal surface is reduced. And a prepped tooth for a crown looks like this. That's what it looks like when it's prepped. On top of that tooth will fit a crown, which is basically like a replica of what that surface that was removed. That's what it's going to look like. And some people refer to that as a cap.